This is our project pitch for Group 5. We've decided to go with the 5 to 7 minute video piece as our final project in the form of a podcast, in which we'll be discussing modern Britain regarding the topics we've chosen and outlined in our group PowerPoint presentation. We're also going to include overlaying images and videos of news report clippings and other relevant media to give context to what we're talking about in the podcast. Since the project concerns itself with contemporary issues, the pandemic will of course play a role in our discussions. One topic we will delve into is key workers during the pandemic who put themselves at risk and even stopped seeing certain family members in order to keep society functioning. Most notably, NHS workers who came into constant and daily contact with COVID patients, risking their own health to save the lives of everyone else. During this segment, we will use our own experience and recount stories not only from the media but from friends and family that worked throughout the pandemic. In certain parts, the video will be overlaid with a montage of news reports from throughout the pandemic, pointing to the treatment of key workers and the severity of the situation. NHS key workers were hailed as the heroes of the pandemic, and yet despite avid demands from the public as well as staff, they did not receive a pay rise. Instead, we clapped for them on our doorsteps as a show of appreciation. While the sentiment is valuable, did this truly impact their lives positively? Should we instead have been emailing MPs demanding the better treatment of the NHS and for staff to be paid accordingly to their bravery? Staff shortages, as well as insufficient equipment, meant that COVID wards were out of control throughout the pandemic, with much of the public unable to receive necessary health care as COVID wards spread onto other general health wards. We will discuss the overwhelming impact that this had on the mental health of NHS workers and potentially read out responses from NHS staff from a pre-prepared questionnaire. The direction of this part of our discussion will be whether or not our current Conservative government did enough for key workers during the pandemic, and if not, what they could have done differently. We will present this argument in a non-biased and purely discussional way, considering many varying facts and opinions. We will aim to have a guest join the podcast who has had first-hand experience with working on COVID wards, or if not, then just working for the NHS during the pandemic. This will provide a more realistic account of events and make for a far more interesting and educational discussion.
Another aspect we would like to cover in our project is social media and influencers and their impact on political issues. Social media is a platform which anyone can use to discuss opinions and debates. Influencers can use their power in many ways, most commonly through consumerism. The idea of creating a glamorised lifestyle which is meant to be desirable to audiences for capitalising purposes has been flagged by users and even gone as far as cancel culture. Specifically, a contemporary issue which we would like to include is the recent outrage of Molly May, a creative director for a fast fashion company, Pretty Little Thing, and an Instagram influencer. What has been described as a tone-deaf interview on the Diary of a CEO podcast portrayed her stance on the playing field amongst social classes. She expressed that Beyoncé has the same 24 hours in the day that we do, and that you can literally go in any direction. This angered a lot of listeners and created an outburst on social media platforms such as Twitter, Instagram, Facebook, and TikTok. It has been argued that many of these discriminatory factors, such as ethnicity, gender, and class, which is our main focus in our project, this led to a trend of a specific tweet: "If you're homeless, just buy a house." These tweets and posts we would like to include in our project, and how the use of social media can have such significant impacts on political issues. Another example would be #KillTheBill, which originated on social media and developed into protests in major cities including Bristol, which had a large impact, and because of this, the bill is being discussed in Parliament and the government may be forced to draw a new bill. Social media is a platform of free speech which allows anyone to express political issues, and this power we would like to portray in our project as it is a very important aspect. As we have chosen to create a video piece, we plan to include multiple screenshots from Twitter, Instagram and Facebook feeds of political activism and videos of TikToks whereby real issues are made into amusing content. to create more interaction with other consumers.
Moving on and speaking about COVID-19 and the government. The coronavirus illness in 2019 is a worldwide pandemic that began in the United Kingdom. As the virus made its way in the United Kingdom in late January 2020, the number of confirmed cases had reached 13.8 million as of December 2021, making it the most prevalent in Europe and the fourth most prevalent worldwide. By the date, there had been 1,297 deaths among those who had recently tested positive. And moving on and speaking about healthcare system in the United Kingdom, it's divided into both the public sector and the private sector. Private medical insurance being purchased by 13% of the UK customers. All permanent inhabitants of the United Kingdom are entitled to free healthcare provided by the National Health Service, which is funded by direct taxation on the general public. The National Health Service in the United Kingdom is made of 4 distinct systems, one for each of the 4 developed countries that make up the United Kingdom, of course. England, Scotland, Wales, and Northern Ireland. Despite the fact that there is policy heterogeneity between those health systems, we have found that no correlation between COVID-19 data patterns and the manner in which care is given in each developed country, of course. As responses from the government, the United Kingdom began to remove lockdown restrictions and progressively reopen borders to visitors. A majority of country citizens have thought, around 57%, have believed that it's a reaction to coronavirus pandemic that has been worse and more negative than it was when we asked the identical questions in April of this year. Moving on to measures that had been taken to make lockdown more bearable. On May 11th, the administration released a recovery strategy, which outlined 3 stages for resuming normalcy following the lockdown. People who are unable to work from home have been actively urged to return to work as of May 13th, provided the social separation. Beginning of June 15, other non-essential retail establishments will be permitted to reopen if they're able to comply with COVID's secure requirements. As for employment-related policies, the JRS was established to assess employers who are unable to maintain their current workforce as a result of COVID-19. That is why the government will then pay 80% of a furloughed employee earners up to a monthly ceiling of 2,500, which is reduced based on the number of hours employees actually work during the calm period. As for the overview recovery plan, the government of the United Kingdom has not yet announced a comprehensive recovery strategy, although it has anticipated that a final budget, which will include policies to address the COVID-19 recovery, will be then released in spring of 2022.